4 vital ovarian cancer symptoms that every woman should be aware of for early detection. One of the main causes of death in the globe is cancer. For many years, scientists and researchers have searched nonstop for treatments for all known forms of cancer. Since there is now no treatment for this fatal illness, we are left keeping an eye out for symptoms and indicators that might indicate a diagnosis. Consider ovarian cancer as an example. Statistics show that in Canada, there were 2,800 new cases and 1,750 deaths from the disease in 2016. In 2016, the number of new cases and deaths in the US was predicted to be 22,280 and 14,240 respectively. Due to how difficult this cancer is to diagnose, there are a lot more deaths than there should be. Its symptoms are frequently misdiagnosed as those of other diseases because there is currently no test that can be used to identify it. The indications and symptoms of early ovarian cancer, according to a recent study, are nonetheless encouraging. With that said, don't forget to subscribe to our channel for more daily tips like this and turn on the notifications bell so you never miss our new videos. Here is some background information on ovarian cancer before I discuss the disease's early warning signs and symptoms. Ovarian cancer comes in 3 different forms. The first is epithelial tumors, which begin on tissue that is found outside of the ovaries. Epithelial tumors are present in over 90% of instances of ovarian cancer. The stromal tumors are the following. They begin on the ovarian tissue, which is in charge of creating hormone cells. About 7% of ovarian cancers are stromal, and these tumors are typically discovered in their early stages. Germ cell tumors are the final variety. They begin in the cells that produce eggs. Typically, only younger women with this form of the tumor may develop it. Understanding ovarian cancer's risk factors, its many stages, and the numerous treatment choices available to women is crucial. If you are concerned that you could be at risk for ovarian cancer, knowing more about the disease will help you know what kinds of symptoms to watch out for. Risk factors. Let's start by looking at the ovarian cancer risk factors. When discussing ovarian cancer, there are a few risk factors to keep in mind, just as with most diseases. You can develop ovarian cancer at any age, but individuals between the ages of 50 and 60 are at an increased risk of developing it. The gene mutation that causes it can also be inherited. The gene belongs to breast cancer genes 1 and 2. Being overweight or obese is another risk factor for developing ovarian cancer. According to studies, obesity may both increase the risk of acquiring ovarian cancer in women and decrease the likelihood that a woman who already has the disease would survive. This is why it's crucial to see a doctor if you're overweight or obese to learn how to change your lifestyle and lower your risk of getting ovarian cancer as well as other cancers. Studies have also shown that women who have children after the age of 35 are at an increased risk of having ovarian cancer, while other research indicates that women who take estrogen after menopause may also be at an increased risk. Compared to women who take both estrogen and progesterone, those who take estrogen just have a higher risk of developing ovarian cancer. Diagnosis. As I previously stated, there are various tests that can aid doctors in making a decision, but there is no test that can definitively diagnose ovarian cancer. The first examination is an imaging test that involves an ultrasound or abdominal CT scan. These 2 tests can assist determine a woman's ovary size and form. The second test is a blood examination that can find a protein called CA125, which is typically present in ovarian cancer cases. Stages of ovarian cancer. There are 4 stages in ovarian cancer. When ovarian cancer is discovered in one or both ovaries, it is said to be in stage 1. In stage 2, the cancer has already started to spread to other pelvic regions. The abdomen has been affected by the cancer spread to stage 3. When cancer is discovered outside the abdomen, it has reached its terminal stage. Treatment. For women who have been diagnosed with ovarian cancer, There are numerous different sources of therapy options. The extent of the cancer's progression determines the sort of treatment a woman receives. The tumor can be treated locally as part of ovarian cancer therapies. This can entail radiation treatment or possibly surgery to remove the tumor. On the other hand, systemic therapy can access cancer cells wherever they may be in the body. This sort of treatment is administered via drug administration and can be ingested orally or intravenously. Chemotherapy, hormone therapy, and targeted therapy are a few of the several medication treatments for ovarian cancer. Depending on the type of ovarian cancer a woman has and the stage of her disease, many treatment options are available. According to how far along the cancer is, the majority of women who are diagnosed with ovarian cancer undergo surgery to remove the tumor. Consult your doctor right away for further details on ovarian cancer treatment. Let's now examine the most prevalent ovarian cancer warning symptoms. Here are 4 ovarian cancer early signs that every woman should be aware of. Number 1. Constant bloating. It may be an indication of ovarian cancer if you experience unusually persistent bloating that lasts longer than 3 weeks. The best course of action in this circumstance is to speak with your doctor to receive an accurate diagnosis. In particular, if you are over 50 or if there is a family history of breast or ovarian cancer, which can increase your risk of developing those types of cancer, you should speak to your doctor to rule out the possibility of ovarian cancer or any other type of cancer if you experience unusual bloating that lasts for longer than 3 weeks. Number 2. Pain in your pelvis or lower abdomen. During menstruation, it is common for women to have pain in their belly, pelvic, and lower back. However, if that discomfort persists for a while after the lady has finished her period, it may be an indication of ovarian cancer. Because it is sometimes mistaken for period pain, this indicator is very crucial for women to be aware of. It is essential to consult a doctor if you feel any strange pain in your pelvis, lower abdomen, or even in your legs. Aside from lower abdominal or pelvic pain, excessive weariness is another sign of ovarian cancer. Keep an eye on your body if you feel particularly weak or exhausted, or if your body does not feel as strong as it once did. It is advised to see your doctor if this persists for several weeks. Mention any further unusual medical conditions or symptoms you may be having. Number 3. Eating issues. You should see your doctor if you start to feel less hungry during a 3-week period. It's recommended not to leave it to chance because it could be an issue with your stomach or intestines, or it could be an indication of ovarian cancer. Another typical ovarian cancer symptom, in addition to appetite loss, is a persistent sense of fullness, accelerated weight loss, or abnormal weight gain. You might also suffer from gastrointestinal problems like burping and heartburn, in addition to these specific eating problems. Constipation, diarrhea, nausea, indigestion, and heartburn are additional ovarian cancer symptoms or indicators. Speak with your doctor right away to rule out the chance of ovarian cancer if you are having problems with weight loss or gain, or if you've discovered that you've developed strange or severe stomach problems. Number 4. Urgent need to urinate. It may be an early symptom of ovarian cancer if you find that you are frequently racing to the restroom to urinate despite not changing your fluid intake. Additionally, if you are well 1 minute then need to use the restroom 2 minutes later, it may be either a bladder infection or ovarian cancer. Ovarian cancer is accompanied by a wide range of symptoms. Numerous other symptoms such as extreme exhaustion, trouble eating, pain during intercourse, odd vaginal bleeding, unexplained weight gain, and many others are also more typical signs of ovarian cancer. Speak with your doctor right away to rule out any health illnesses or issues if you have one or more of these symptoms or any of the ones discussed in this video. In order to make sure that your health is in good shape, you should also make sure to eat a diet rich in nutrients and incorporate some form of exercise into your life. What more early signs of ovarian cancer are there that were not covered in this video? Let us know in the comments section below. If you enjoyed watching Vital Health TV and learned something from this video, please hit the like button and subscribe to our channel for more videos like this. Thanks for watching!